Hello, my name is Dr. Jemiel Nejim. I'm an attending here at Hospital for Special Surgery. I'm also a critical care trained physician. I'm here today in our orthopedic special care unit, and I'm going to show you how to perform a lung exam. We'll primarily use it to evaluate for pneumothorax. For today's lung exam, the probe that I'm going to choose to use is the small curvilinear probe. With that said, any probe can be used to do a lung exam, and the small linear probe is a great choice as well. I use this because it allows me to get in between my rib spaces easily. I place the patient in the sitting position, and notice that I hold the probe in between rib spaces in or near the midclavicular line. This exam can be performed both on the right or the left side of the patient, wherever you would expect a pneumothorax. The reason I position the patient this way is because air rises, and so this would be the most likely area to find a pneumothorax. In order to optimize this image, small changes can be made in terms of decreasing the depth and also decreasing gain. This is an image of our lung field using the small curvilinear probe. What I'm actually showing here is the batwing sign, which is in between two dark rib spaces. We can see bright pleura. I'm having the patient take a big deep breath, and you can see the pleura sliding here. In order to better evaluate, we can use M mode. So this is an example of M mode. This is described as the seashore sign. Really what it looks like is ocean waves crashing on a sandy beach. These are the ocean waves. This is our bright pleura here, and what you can see here is the speckled appearance of normal lung fields as the pleura slide along each other. This is a normal appearing lung. In a pneumothorax, you would not see this speckled appearance of lung up against the pleura. The last thing I'm going to show you today on our lung exam is our B-lines. B-lines are normal comet tail artifacts that emerge from the pleura and go out all the way to the edge of the screen. It's normal to have between 1 and 3 B-lines in any field, and all this indicates is an interaction between fluid in the pleura and the lung. If you see a B-line, you can confidently rule out a pneumothorax. As I mentioned, it's normal to see between 1 and 3 of these B-lines. However, if you see greater than 3, suspect increased interstitial edema that can occur in a process such as pulmonary edema or ARDS. This concludes our tutorial on the lung exam. To review, we showed you how to perform the batwing sign to identify the optimal lung field, as well as showed you a variety of ways using pleural sliding and B-lines to identify and or rule out a pneumothorax. We also used M mode, showing you the seashore sign as another way to rule out pneumothorax. Finally, we also used B-lines as a way to identify increased interstitial fluid, as can be seen in processes such as pulmonary edema and ARDS.